Hello everyone, welcome to Pharmify. If you are confused about which course to select after class 12 or graduation, this video is for you. Today, we'll be discussing the key differences between Pharm.D, D.Pharm, B.Pharm and M.Pharm, including the duration, eligibility, scope, and career opportunities. By the end of this video, you will have a clear idea of which path suits you well. So let's get started. Our first course is D.Pharm, which includes a 2-year session with 4 semesters and a 3 month mandatory internship. The eligibility criteria to enroll in D.Pharm is +2 with PCM or PCB with approx 45% aggregate marks, and your age should be 17 years by the 31st of that admission year. And if I talk about scope in D.Pharm, it is community, hospital dispensing, drug formulation, basic pharmacology, suitics, and much more. The minimum and note points to be noted. D.Pharm is the minimum qualification which is required for drug licensing. And also, it makes you eligible to get your lateral entry in B.Pharm second year. You just need to skip first year. Directly in B.Pharm second year, you can get enrolled. Career opportunities after D.Pharm are you can be a registered pharmacist, a medical store owner, or a chemist, pharmaceutical sales representative like MR or something like that. You can also opt for government health departments. Our next course is B.Pharm, which is Bachelor's of Pharmacy. Its duration is 4 years with 8 semesters, and obviously, as discussed in D.Pharm, you can get your lateral entry in it. And if I talk about eligibility criteria in B.Pharm, it is +2 with PCM or PCB with minimum marks above 50%. You can also enter by NEET or state level exams like CUET and other competitive exams. Scope of B.Pharm is you get the deep knowledge of core pharmaceutical sciences of drug formulation, pharmacology, medicinal chemistry, regulatory affairs, quality assurance, and production. And if I talk about the foundation course, B.Pharm acts as a foundation course in M.Pharm, Pharm.D, and MBA, and it also makes you eligible for exam like GPAT. Career opportunities after B.Pharm are a pharmacist, a hospital or retail, medical representative, production executive, drug inspector, QC or QA officer, and also you can work as a research associate. Our next program which we'll be talking is M.Pharm. It is a 2-year program with 4 semesters, and for the eligibility criteria for M.Pharm or Masters of Pharmacy is 55% marks with B.Pharm or an exam of GPAT or some other PG exam like CUET, etc. And the specialization in which you can opt for masters are pharmaceutics, pharmacology, pharmacognosy, pharmaceutical chemistry, clinical pharmacy, quality assurance, and regulatory affairs. And if I talk about scope or career opportunities after M.Pharm, you can work as advanced research and in pharmaceutical industry. You can also opt for teachings and academics. You can also go for drug regulatory bodies like WHO, FDA, and CDSO. And the next course which we'll be talking is Pharm.D, which is Doctor of Pharmacy. No, point to be noted, you are eligible for clinical doctorate in Pharm.D. The eligible criteria for Pharm.D is +2 with PCM or PCB with minimum 50% marks, and your age should be minimum 17 years. It is also applicable for post-baccalorates, where you will be opting for 2-year study plus 1 year hospital internship. And B.Pharm from a PCI recognized institution with around approx 55% your academics. Scope of Pharm.D is you are focused on clinical pharmaceutics, unlike B.Pharm, which is focused on cognosy, production, and etc. If I talk about career opportunities after Pharm.D, it is clinical pharmacist, drug information specialist, pharmacovigilance officer, medical affairs manager, and you can also go for international residency programs. Let's take a quick brief and compare all these courses simultaneously. In D.Pharm is diploma, B.Pharm is undergraduate, and M.Pharm is a postgraduate program, where Pharm.D is a clinical doctorate. Duration varies from 2, 4 to 6 years. Eligibility criteria, and if I talk about eligibility criteria, it's +2 with D.Pharm, B.Pharm, and Pharm.D. But for M.Pharm, it requires Bachelor of Pharmacy, which is a foundation course for it. And to get eligible for these courses, you need to crack some GPAT or state university exams. And if you talk about focus, in Pharm.D, we primarily focus on dispensing and practice. In B.Pharm, we focus on pharmaceutical sciences, pharmacovigilance, cognosy, chemistry, etc. And in M.Pharm, we go for research and specialization. In Pharm.D, we work with patient-oriented work. Regulatory bodies, if I talk about, it's PCI plus AICTE. Basically, these are the governing bodies which look after these courses and design courses and all. If I talk about average salary, obviously, if we are working or studying something, we look for salaries also. For D.Pharm, it's 2 to 4 LPA, B.Pharm is 2.5 to 5 LPA, M.Pharm is 3 to 6 LPA. With Pharm.D, it reaches to 6 to 14 LPA with some experience. If I talk about global recognition, D.Pharm has a limited recognition, B.Pharm has a moderate recognition, with M.Pharm a good recognition globally. And if I talk about Pharm.D, it's a high recognizing course. That's all for today, and thank you for joining us.